Hi everybody, my name's Kerry Porter. I'm Primary Care Workforce Programme Manager at Greater Manchester. Here today to give you a couple of updates of things that are happening across Greater Manchester. So first of all, we're going to start with the skilled worker visa, the Tier 2. So what is it? Basically, it's the main immigration route for skilled workers to take up employment in the UK. And from the 1st of January 21, it also includes all EEA citizens because of Brexit. And why am I telling you this? So we have a significant number of international medical graduates taking up GP training. They're currently sponsored by Health Education England during their training period. But once they're qualified, they need to find a practice that holds a licence. So GPs are also on the shortage occupation list, and what we're keen to do is retain as many of those doctors that train within Greater Manchester and find them employment. So in terms of what you need to do to obtain a licence, it's quite a straightforward process as long as you've done all your preparation beforehand. It's an online application. There are supporting documents, but if you have everything in order, it takes approximately 20 minutes. There's a fee involved, but luckily across Greater Manchester, we are reimbursing that fee at the moment. And once you have a licence, it's actually valid for 4 years. So even if you don't need to recruit right now, but you're looking to do some succession planning in the coming months or within the next year, then it's a really great opportunity and puts you in a strong position to attract all of those doctors that are newly qualified. On top of that, we also have a helpline through a dedicated solicitor called Alex, and he's there to help and support you with some of the more technical questions that you might have. What we're hoping to do is have a skilled worker workshop on the 24th of May. There's going to be 2 sessions, 12 o'clock till 2, and then an afternoon session as well. Alex will be on hand, so we're looking to either hold this in person or virtually. There's a link there that you can click on to express an interest and tell us what works best for you. So whether that in-person workshop or the virtual workshop. So why not come along, register with us, and we look forward to seeing you there. I also wanted to take the opportunity to remind you about the GM Workforce Bank. So this is access to locum GPs. You might be aware that in the past we commissioned the service from Lantham. You can obviously, of course, continue to use Lantham. However, it's not reimbursed by Greater Manchester. We've been working with GM Federation to provide a bank of GPs, and we have over 150 GPs now registered. We have a number of organisations registered as well, but we were really surprised in December that actually there was only a very small proportion of shifts that were posted. So we're wondering, do you know about it and how can we promote this? So at the moment, there's a survey that we're undertaking just to understand what's working well or not working well so that we can flex and change the service around you. But if you didn't know about it, registration is really simple and it's free. So the links are all in this slide here, and we will be sharing the slides with you after this meeting. Whilst we're on the topic of recruitment, I also wanted to remind you about the GM Workforce Connect. So that's our digital matchmaking service. So again, it's free to use. You can basically register on GM Connect. You upload any vacancies that you have, you include the URL, and anybody that's registered on GM Connect, they can then reach out to you directly. The same token, you can reach out to any individual that's registered on there that you think might be a suitable candidate and fit within your practice. So again, that's just another tool to help you attract recruitment within your practice. And it's open to all the roles, and we're actively trying to grow the number of individuals that are registered looking for employment across all the disciplines that might be beneficial to you. And then finally, what I wanted to share with you is the nursing pathway. So you might be aware that we've been working quite hard with Leslie Royal Pryor, who's our nursing community leader within Greater Manchester, to develop the nursing pathway. We now have a healthcare support worker foundation programme. We have a nursing associate foundation programme, and a GPN foundation program. So that's all the clinical skills that they would need if they're new to primary care or transitioning into the role. The programme is supported by training pods. So depending on which locality you are, the training pods are being developed. So currently the training pods are live in Salford, Stockport, Manchester and Tameside. So that's a nurse that's able to support these learners complete their training. For the healthcare support worker, the module that's available to them is the care certificate. There's also access to support functional skills if they wanted to go on and become a TNA. There's phlebotomy training in there as well as IMS and VACs. And in terms of the clinical module that they have access to, it's the CVD. The nursing associates and the GPN have access then to the CKD, the IHD, respiratory and diabetes module. So really, really comprehensive module available to them. And there is the ambition that there'll be training pod nurse leads available right across Greater Manchester. So if you don't believe that you have a training pod available to you, then please get in touch and we'll be able to give you more information and a timeline of when we think that's going to be going live. So that's the flyers. Looks like a very busy slide, so apologies for that. What I really wanted to draw your attention to is the flyer in the bottom right-hand corner, so the GPN Specialty Training Scheme. So this is where there's funding available to support the recruitment of the nurse. In the first year, it's 2 days funding, so that's to allow them to complete the foundation training and also to link them to the training programme called the fellowship. So that's around leadership, peer support and mentorship. And then in the second year, it's anticipated that they will have completed the foundation programme, but that they will continue on their fellowship journey. And that's so there's funding to reimburse a session a week. So a really, really great programme. But what I would say about the specialty training is that it's linked to PCN development. So the nurse should be working right across the PCN, even if they are employed directly by one practice. So interesting stuff. Hope that's something that you think would be beneficial to you and your practice. And then lastly, just to remind you that Greater Manchester, in partnership with GP Excellence, does hold a regular practice manager forum, and you are absolutely welcome to come along to that. The next session is the 27th of April. We've got some really interesting topics planned. If you'd like to register, then basically just click on the link and we would welcome you along. So that's the primary care workforce team. If you have any questions or queries, then please do get in touch with us.